To perform high-quality chest compressions, rescuers should push hard and push fast. Push hard means that the rescuer should compress the chest at least 2 inches. This is a change from the previous guidelines that suggested a compression depth between 1.5 and 2 inches. The chest should completely recoil after each compression. If it does not, coronary perfusion will remain low. Push fast means to deliver at least 100 compressions per minute. Scientific studies show that the rate of chest compressions is directly linked to ROSC and neurological survival. It can be difficult to maintain such a vigorous pace, which is why the American Heart Association recommends that rescuers switch roles after 2 minutes or 5 cycles of 30 compressions and 2 ventilations. Another characteristic of high-quality CPR is minimal interruption in chest compressions. Studies demonstrate that even healthcare providers interrupt compressions far too often or for too long, in some cases spending 25 to 50% of a code without delivering chest compressions. The American Heart Association cautions providers against spending more than 10 seconds checking for a pulse or assessing the patient. Finally, high-quality CPR must avoid hyperventilating the patient. For arrest patients, appropriate tidal volume should be approximately 500 to 600 milliliters, enough to see visible chest rise. This is about half a bag squeeze of an adult ventilation bag. Hyperventilation can not only cause gastric inflation and resulting complications, but excessive ventilation increases intrathoracic pressure, decreases venous return to the heart, and lowers cardiac output and survival. In terms of defibrillation, there are no major changes in the guidelines. The emphasis remains on a fluid integration of defibrillation within high-quality CPR. Rescuers should start chest compressions and use the AED as soon as possible for the best patient outcomes. The AHA still recommends the one-shock protocol for VF and pulseless VT. Let's review the changes to the BLS survey, which is now made up of these 4 steps. Check the patient for responsiveness. Activate the emergency response system and get an AED, then check the carotid pulse. If you cannot detect a pulse within 10 seconds, start chest compressions immediately. Give 30 chest compressions followed by 2 ventilations. If indicated, deliver a shock with an AED or defibrillator. Also emphasized in the new guidelines are minimizing pulse checks, limiting interruptions in chest compressions to 10 seconds, delivering high-quality chest compressions in rapid defibrillation, switching rescuers every 2 minutes to avoid fatigue, and avoiding hyperventilation. BLS is the foundation for ACLS. The better these steps are performed, the better the patient's chance of survival. There are 4 general categories of changes to the Advanced Cardiovascular Life Support Guidelines. Changes to the cardiac arrest algorithm, the addition of a new post-cardiac arrest care algorithm, updated recommendations for airway management, and synchronized cardioversion.